You know, I think it's very true to see that the
not the kind of news we hope for from the CDC these days, but today it was the news we got. The CDC has just changed its current guidance about when Americans should wear masks in response to the alarming spread of the highly infectious Delta variant of COVID-19. In a dramatic reversal from its previous guidance, the CDC now says that all vaccinated Americans should wear masks while indoors if they are in areas with what the CDC calls high or substantial levels of transmission. Look at the map. The red represents areas with high transmission. The orange is substantial, which is a lot of the map. According to the CDC, transmission is high enough in 63% of the country right now that indoor mask wearing is now recommended regardless of vaccination status. And that was not the only stunning reversal out today from the CDC. 2.5 weeks ago, the CDC said that fully vaccinated students will not need to wear masks when they return to classrooms this fall. Today, they took that back. The change in policy also applies to all students or people who work in the classroom. The CDC says it's recommending that all students, teachers, staff, students, and visitors wear masks in all K through 12 schools this fall, regardless of their vaccination status. Joining us now is Dr. Rochelle Walensky. She is the director of the CDC. Dr. Walensky, thank you for your time. Thank you for being with us this evening. The reaction I've seen on social media to this is it's giving people whiplash. The CDC has changed fairly suddenly, in the opinion of some people. Give me a sense of the science behind this decision.
Good evening, Ali. Thanks for having me. The first thing I want to convey is that that map has a lot of orange and a lot of red, where we have not put up a large enough fortress as a population to tackle this Delta variant. And so I think that that's really important, because the main message here is that map looks like that because we haven't done a good enough job in getting people vaccinated. The most important message here is to get vaccinated. 80% of those counties that are orange or red have less than 40% of people vaccinated.
Wow.
So those counties very much correspond to the people who are under-vaccinated in this country. But when I became the director of the CDC, what's happened in the last 2 months is that now we have 83%, if not more, of our sequences that are the Delta variant. We know the Delta variant is much more transmissible even in the absence of vaccination. We see that in the map and why it's gotten so red so fast. And what we learned really just even in the last several days is that if you happen to be somebody who is vaccinated but got infected anyway, a vaccinated person that was a so-called breakthrough infection, that those people can now, with the more transmissible Delta variant, transmit to other people. And that was really why we updated our guidance with the update of new science that came over the last several days. A rare event.
So in the last day or so, we've heard from New York City, the state of California, the Department of Veterans Affairs, that they are requiring people to be, vaccinated or provide proof or ongoing testing. Do you think we are approaching a time where we should be empowering organizations and companies to be able to do that, to mandate vaccination?
Yes, I think that is exactly what needs to happen.
You changing any of your behaviors in terms of travel, in terms of interacting with people, and how you're dealing with other people?
This weighs heavily on me. America is sick. America has seen a lot of people suffer, and America has suffered a lot of loss. So this is not something that I expected would be welcome news to us. I am definitely masking more now. It was certainly not something that I wanted to do, but my job, we've been doing this for 18 months. I'm tired of the American people, and so this is what I felt we had to do with the new science that was given to us.
Dr. Walensky, thanks for your time tonight. Dr. Rochelle Walensky is the director of the CDC. We appreciate you being here.
So once again, Centers for Disease Control has changed its guidance on masks and COVID. The CDC now says, announcing today, all Americans, including those who are fully vaccinated, should wear a mask inside of areas with high transmission of the virus, which, according to the CDC community transmission map, which highlights areas of high transmission in red, appears to be a whole big swath of the country. To help explain this change in policy, I'm joined by Dr. Anthony Fauci, Director of National Institute of Allergy and Infectious Diseases and Chief Medical Advisor to President Joe Biden. Dr. Fauci, Dr. Walensky was saying that at the announcement today that this was based on data they've been collecting sort of in real time about Delta variant transmission. So what's the data, and what about the data pushes towards this as the policy recommendation?
Okay, there are two aspects, Chris. One, we know that people who are vaccinated but still get infected with the Delta variant. But even more importantly, it is clear now that no vaccine is 100% effective. Mm-hmm. We've learned clearly now, without a doubt, when there are breakthrough infections, that people who are vaccinated get a breakthrough infection, actually have enough virus in their nasopharynx. We've learned clearly now, without a doubt, that they can actually transmit it to other people. But even more importantly, it is clear now that even if you are vaccinated, have documented transmitted to other people, which happens because no vaccine is 100% effective. So because of that, the virus has really changed, and that has really triggered the change in the CDC guidelines. So right now, the way you correctly said, that even if you are vaccinated, you need to wear a mask in indoor public settings in the areas that have a high degree of transmissibility, namely the orange and red areas of the CDC designation.
So when we spoke about the decision by the CDC to say you didn't have to mask indoors if you were vaccinated, the key driver there was data about virus transmission amongst those folks vaccinated. You were on the program saying you don't really, and that it's okay to be indoors.
Right.
Now, I guess it's just different with Delta, but do you understand why people might feel a little whipsawed
Sure.
Between the last announcement and this one?
Yeah, it's thoroughly understandable. But when you go back 60 days or the 2 months ago,
there was more question about whether you had viral load to transmit.
Even if you are vaccinated.
The data came back saying you don't really, and that it's okay to be indoors.
Right.
Now, I guess the data is just different with Delta.
When you look at the level of virus in the nasopharynx of a person who's vaccinated and gets a breakthrough infection, and even if you are vaccinated, that has changed, because when you look at the level of virus in the nasopharynx of a vaccinated person, it is exactly the same as the level of virus in a unvaccinated person who's infected. That has changed the entire landscape. And even if you are vaccinated, that's the problem. So those data are very compelling, and that triggered the change in the CDC guideline.
That is fascinating to me, because I know basically nothing about medicine, but I guess my intuition would be that the viral load would correlate to severity of illness. And what I'm hearing from you is that, like, you've got a situation in which,
even if you are vaccinated,
Delta is producing a higher viral load and higher viral load shedding by orders of magnitude.
But there really is a pretty clear explanation of it. And here are the data.
The data we have is to be believed.
Right. Chris, you nailed it, because
I think it's very true to see that the country has so much disease right now that is in this country.
Clearly now, without a doubt,
this country has gone after those who are unprotected, unvaccinated, and the vast majority of transmission that is happening in this country.
We've learned
this country getting sick more than they would during a standard flu season, and more deaths indeed.
President Biden is expected to announce today or very soon that he wants all federal workers to get the vaccine. Are you hoping that private companies, I know it's their decision, but are you hoping that private companies will follow suit?
I am hoping that we will do everything to unify as a country to get more and more people vaccinated. And if that's one strategy in our country, I'd be all for it.
Thank you very much, Dr. Rochelle Walensky. We appreciate your time.
Thanks so much. Country.
Right? The big fear was that you'd have
even if you are vaccinated.
It appears to be a whole big swath of the country, and yet not leading to a whole big swath of the country. Severe illness in the country would essentially evade the vaccine. The way that you would fear, right? The big fear was that it appears to be a whole big country.
Right. Chris, you nailed it. Even if you are vaccinated.
The vast majority of Americans, the risk is very, very low. Young and healthy people can expect to recover fully and quickly if they should get the virus. The highest risk is for elderly population with underlying health conditions. The elderly population must be very, very careful. In particular, we are strongly advising that nursing homes for the elderly suspend all medically unnecessary visits. In general, older Americans should also avoid non-essential travel in crowded areas. My administration is coordinating directly with communities with the largest outbreaks, and we have issued guidance on school closures, social distancing, and reducing large gatherings.
Those who aren't killed by the virus will probably die in the fighting. So maybe this is it. This is how it ends. Pretty soon, there won't be anyone left.
Even if you are vaccinated. No vaccine is 100% effective.